Hey, this is Different Careers with Kate Nudd. Again, right now, I am a licensed massage therapist in New York State. So who knows, maybe one day that will change. But today we're going to go over another continuing education course. I'm going to give a review. The course is called Palpating the Hip Flexors with Joe Musculini. I don't know how to pronounce it. So it took about 12, 1, 2, over an hour and a half probably. I haven't calculated the time. I'll have to put that in the description below. Learn to accurately palpate the hip flexor muscles to ensure you're providing targeted treatment on the commonly tight area that can lead to multiple issues in the body. This comprehensive course from Dr. Joe Musculino teaches 2 different palpation strategies for 12 hip flexor muscles in the flexor and extensor compartments of the thigh. When you are confidently palpate each muscle in the region to accurately identify the problems, you're able to create a targeted treatment plan that leads to successful sessions. So, So course outline, that's what they went over. Very thorough, I will say that. And this guy is Dr. Joe Musculini, has been a manual movement therapy educator for more than 35 years. He has created several online streaming subscription platforms for manual therapy continuing education, including Learn Muscles Continuing Education with more than 3,300 video lessons and more than 320 hours of blah 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 credit. He has also created Massage Therapy Master online curriculum, a full online curriculum for massage therapy schools. He is an author of multiple textbooks and with Elsevier and has authorized more than 90 articles. So if you need to learn, if you need more information, it goes learnmuscles.com. So let us get into the review. So he had like notes. So he didn't do any references or anything. But then there was an article portion through the massage body work. And sometimes this comes in the mail. So it was from the February 2024 edition. So I assumed that this video was recently made and it was limited amounts of pages. So it was like page, if you can see, 46 all the way to it was like 10 pages long. So they just gave you like the 10 pages to page, it's not like showing up real good, 55. So like I did read that before, so it did take a little bit longer than like over an hour and a half, because I was reading it. I kind of skimmed through the article, and he went over certain things. Part of my problem is in massage therapy school in New York State. In my myology class, it's the study of muscles. Okay. Like, I think you were supposed to learn how to palpate the muscles yourself correctly. But the problem is my chiropractor teacher did not like get on a massage therapy table and demonstrate how to palpate the muscles on yourself. So he like had a student get on the table and then like and then he's like because by showing it palpating on the student or whatever, then he's like, okay, now like work on each other. And for me, because I'm a hands-on learner, for some reason, to understand the muscles better, like I think it has to do with a unique learning style or something. I don't know. But I needed to have someone show me how to palpate the muscles on themselves, then watch me palpate the muscles on my own self, and be like, do I need to move over a little bit more or whatever, or like move my hand over and be like, yeah, this is the border, this is the area. And no one did that for me, so I don't even know how to properly palpate the muscles on my own self, like some of them, not all of them. And so in certain areas of the body, like to me, that's something like you really need to do that area yourself. But if you need to educate someone that comes to you that's a massage therapy client, like there needs to be a better way of doing that. So one of the things that I learned in massage therapy school is there's like proper draping, and like they're like, you do not go beyond this line when massaging people. And to me it was implied 100%, because they never showed how if someone was fully clothed that you could go beyond the line. So I thought it was the rule of New York State is 100% that if there's a draping line, you don't go beyond that line even if someone has clothes on. So you work around the same parameters as you would drape properly. So we'll get into it when we watch a clip from this video.
Dr. Brevis. Then I go past that, and now I should be on gracilis.
Look how close he is to the groin. That looks very invasive to me, like it would be completely unprofessional, inappropriate, like you're getting way too close to that area. And so I'm not sure why this got approved as a New York State continuing education class.
Now, gracilis is a muscle that when you look at an anterior view, it looks very thin, the way I'm showing you my right hand right now. If you look at a posterior view, it will look very thin, the way I'm showing you my hand right now. But if you look at a medial view, instead of being thin, you'll see that it actually has some appreciable width to it. So this is a plea for me that we need to look at more than just anterior and posterior views. We need to look at more than just superficial views. The gracilis has some definite width, and it's going to be in the medial thigh here. I have to find the joint action of gracilis that's most different from the adjacent muscles. And I can, because the gracilis is one of the pes anserine muscles. The gracilis crosses the knee joint posteriorly, therefore it flexes the knee joint. So if he were to flex his leg at the knee joint by pushing down against the bolster here with the proximal posterior portion of his leg, lower leg, then that should engage gracilis. Let me make a point here before I ask him to do this. The bigger the bolster you have, the easier it is for someone to do a joint motion isolated at their knee joint, whether it's extension, straightening out, or flexion, trying to flex in against the bolster, because there's more of an angle here, more grab against the bolster for the flexion. So, Scott, can you try and push into the bolster here? Up, relax for a second. You're kind of lifting your thigh up here. And this is an excellent teaching example. We ask for something. The client is an uninformed client. They haven't taken anatomy and kinesiology courses. They don't know exactly what flexion of the hip joint is, or abduction of the shoulder joint is, or whatever the motion might be. We need to use whatever words will best give them the sense of what they need to do. And after I ask a patient of mine to do something, I always look to see that they're actually doing it. If I'm blind somewhere, looking somewhere else, closing my eyes, trying to feel, I don't know if maybe they haven't done it correctly. So I always first check to make sure that they are doing what I'm looking for them to do. And if they're not, then we simply try to correct it however we can. So I want you to feel like you're pressing down more here. Maybe your heel might go into the table a bit. However you feel, you can push against that bolster. Try it again. And relax. And I'm going to slightly move the bolster down just a little bit.
So again, it was very informative. I did pass the quiz the first time around, so I was happy about that. To me, it was I felt like it was a waste of time because I feel like I can't apply any of these techniques into my practice because like my perspective is it's not New York State approved. You would for me to be able to apply this to massage therapy clients, to me, I would need a massage therapy tool where it's like if you have this problem, you need to be wearing some kind of shorts, athletic shorts, and then I need a massage therapy tool where I'm going in with like a rock to palpate these muscles and like work them out a little bit for you, or a massage therapy scraper where I'm not actually scraping the muscles, but I'm using it to apply pressure to this area because I don't want my hands in this area because it is too close. It's an invasive technique. So, to be honest, I think this is one of those things like a medical doctor because they have the license to examine people and disrobe people, and then they have like I don't know, what are those like garment things you put on in like the doctor's office and be like, I need to examine your full body to make sure your skin's okay, that you don't have cancer. You know, they have the license to examine like the genitalia area. So it's like if they did this technique with gloves on and someone had like sports, they could teach their clients how to like massage their groin area or genitalia area themselves. And like, to be honest, as a licensed massage therapist, this isn't something I want to do. Like, I will do this like palpate this area on myself and massage myself, but I do not want another massage therapist getting this close because it's like a red flag and it's a red flag to me, and it makes me feel like they're an unprofessional massage therapist. So this is not a New York approved technique, but it showed up on ABMP as like New York approved for some reason. So did my massage therapy teachers not teach me properly? Did they miss something in my training course? Because I was required to do 1,000 hours of massage therapy hands-on stuff where it's like you're in doing classwork, whether it's like you're learning the classes, you're learning hands-on techniques, and then you had like 100 hours of a clinic, and that included chair massage. Like, I forget everything, but it was 1,000 hours just to do your schooling in New York State, and they never thoroughly taught you how to palpate each muscle through the clothes thoroughly. So does New York State need to add hours and make it like 1,500 hours to become a licensed massage therapist so you can thoroughly palpate the muscles properly, know how to palpate on yourself, know what areas it's okay to thoroughly work when someone's wearing some kind of sports wear where it's like yoga pants or whatever. What's appropriate for sportswear, to have someone on your table, because people have like different modesty standards. So like I don't feel like now, after seeing this class, that I was thoroughly educated on what's it called, massage therapy techniques while people are wearing sports clothes, because like some people may have like some kind of sports injury or something in their hip flexors that they need to be addressed. So but how do you do that in a professional manner? So like to learn how to do this, I feel like I would need an instructor, face to face, learn how to palpate it on myself first, then explain to the instructor I'm from New York State. You also need to make sure the class is New York State approved. So, is the class New York State approved? So if it wasn't, I couldn't go there anyways. But if it is New York State approved, because sometimes instructors teach classes to people from multiple states. So then you have to like remind them, oh yeah, I'm from New York. How do we do this in New York only? And it's done in a professional manner. And then like if any other questions come up, then you do that. So typically when it comes to, okay, let's see, there is a picture somewhere, I have to find it. Okay, here it is. So there is this muscle right here, which is called iliacs and the psoas. To get this muscle, a lot of times people find that this muscle is very tender on them or sensitive. And so you have to apply pressure through this muscle. I've gotten to the point where they show, like in massage therapy school, they showed how to properly expose the abdominal muscles, and then you get access to the front side of your hip, the anterior side of your hip. But I've gotten to the point where I just work it through the sheet because it feels like it's done in a more professional, safe way, so my clients don't feel like I'm unprofessional in any manner. So I feel more comfortable now just like working that area through the sheet, and that's it. And I just get the anterior muscles of the hip. And I only do that in a deep tissue massage. So that's how I do it. So, and the place where I work is a spa, and the owners of the certain franchise that I work for, they made the rule you're not allowed to massage the abdominals, but this is the front side of the hip, so I just get it through the sheet. And yeah, so that's all I'm going to say. So yeah, and then it frees it up. But again, I'm asking a question before they come in, like, do you feel muscle tension in the front side of the hip, or is it just your glutes or the butt muscles and the back? So I typically only work this if they're like, please, 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 like I definitely feel muscle tension, pain, or annoyance, like please free up the muscle. And I usually just work it a little bit, where I'm working it like 90 seconds in this area, and then like 90 seconds, like it's more not in here, but it's more like, it's like here and down in a little bit. I don't, like, you would have to feel it on your hip, where it's like you have like the top part where it's like you're kind of over the bone a little bit here, and then you're going like in deeper, and you're like releasing the iliacus and the psoas muscles that are attached in that area. So, but again, typically, like, here would be my like drape, like underneath my fingers. You're just gonna like be like massaging like from here down. You're you're not gonna, he was like getting like really close in here. Like, I'm not going to be doing that. So you need to go to a doctor. You need to go to someone that's certified to get this, or you need to massage that area yourself, because I'm just going to do everything down. So that is my critique of this. So it took over an hour to complete this, and that was including reading the little article. So like over 90 minutes. And I did pass the quiz the first time around, but the material I could not apply to where I'm working because it's not New York State approved. So like I give this continuing education class an F. So I hope you enjoyed this video. Until next time, if you have any questions relating to massage, feel free to put that in the comment section. Feel free to like and subscribe to this channel if you want.